Hi, I'm Dr. Rebekkah Frunzac. I'm a general surgeon and I work at Mayo Clinic and Mayo Clinic Health System. I was born in El Paso, Texas, and I did all of my education in Texas. My undergraduate is from Baylor University in Waco, Texas, and I went to medical school in Dallas. I traveled up here to Rochester for residency training in general surgery and have stayed here since. My communication style tends to be relaxed and interactive. I think that it's really important to meet people at the understanding level that they come in with, and so I try to adapt my conversation to meet the needs and the understanding level of my patients. And I think that patients can receive the most from their healthcare by being engaged in their own care. Healthcare is definitely a two-way street, and patients can contribute just as much to their excellent outcomes as physicians can. As physicians, we can guide you and give you advice and direction, but it's going to also require an investment on your part in order to achieve an excellent result. Our job is to facilitate that, to support you in those endeavors, and then to congratulate you and to reward you when you've invested in your own healthcare. I think that having a relationship with patients is really important, so I would describe myself as somebody who's collaborative. I want to work with you to see that you are able to achieve the best possible outcome from your procedure, or if we can avoid a procedure, also to support you in that endeavor. I generally feel like people find me approachable and compassionate, but I'm also a little bit firm sometimes when I have an expectation for you to contribute with me to your own healthcare. When I'm not working, I enjoy being outdoors as much as possible. I don't have any real technical interests or hobbies that are unusual, but I have a little boy and we go out and we play, we garden, enjoy spending time with my husband who's a gymnastics coach, going to gymnastics events, and just being as active as possible.